All right, happy Monday. Today is August the 3rd. It's a new month. It almost feels like we're actually almost like way past the halfway mark of 2026. Some of us are really excited. Some of us can't wait for this year to be done. But nevertheless, so this week, before I dive into my weekly metrics, I wanted to touch on a trend that I actually saw. This was from the Wall Street Journal. There was an article about the number of uninsured patients in the hospital, so it's already starting, right? And I think one of the key things that's mentioned in this article is about the Affordable Care Act. Some of the plans are actually being phased out, and so definitely it's going to impact a couple of percentage of the population. As far as it actually, they say about 2.6 million people fall off from the Affordable Care Act. Some of those subsidies, right? Some of those subsidies actually helped in premiums, right? There was some policies that were there to help with the rising costs. So some of those subsidies are actually going to disappear. Some have already disappeared, and some are going to disappear in 2027. By the end of 2027, they won't be renewed. So this article just simply states that, hey, the number of uninsured patients going to hospitals is actually on the rise. And one of the laws that we do have is there's these HIPAA laws. HIPAA laws is more for you can't share information and things like that. But the other thing is that do no harm, right? Hippocratic oath, whereby, hey, you can't really turn down someone that actually is in need of medical attention. So someone has to bite that cost, because there's a cost, right? And it's going to spiral into other things, right? It's going to spiral into big pharma. It's going to spiral into several other things. And I think the key thing, like the whole idea about bringing this article up is not, we already knew this trend was about to happen, right? But the only thing is, what else is actually what is the cascading effect of when people lose health insurance, right? And that's really one of the key important reasons why, like, I started this journey of agency, right? Agency where you're taking full responsibility, because, hey, if those prices start to go up and you're phased out, what's going to happen, right? You can't find a medical doctor. It's going to be extremely expensive. A prescription medication is going to be extremely expensive. Tests are going to be extremely expensive. But there's things you can do to actually hedge against those costs. And those costs are only going to be going up, right? They're only going to be going up. Like, it's not going to get cheaper. It's just going to get more expensive. So how do you actually hedge against those costs? Is to start taking agency. And the way you take agency is you become responsible for your own healthcare. You almost customize your own plan, right? Based on your needs, your diagnosis. And this is why, having these bio readers, like the watch, like the iWatch, or I'm actually getting another one called Hume Health 2.0. I did a little bit of preliminary research, and I found that that's the one that's able to actually collect all the data that I really need to be able to make informed decisions as far as lifestyle. And I would recommend to everyone, hey, you don't have to start benching like 300 and running, 50K miles, but you can start with, hey, let's look at the data. If you're not feeling great about how your health is, start taking one step, right? It could be as simple as, hey, I'm going to start walking at least a mile every other day, right? Or 3 times a week, right? I'm going to start cutting out sugar, right? Or processed foods. Or I'm going to start tracking my sleep data. Because remember, optimal health doesn't happen in an instance, right? It comes from consolidated habits over time, right? So, and you'll never, if you always constantly are feeling like, I can't start it, or I'm way too behind, or my health is really messed up, it only just gets worse and worse, right? So there's something you can do. You can start with the steps, just feel good about hey, going to take walks at least 3 times a week, right? And then, hey, cutting out going into the pantry, because health is really more behavioral than anything else. It's more lifestyle. I mean, there's definitely some instances where, there's a genetic marker which you inherited even either from your parents, right? And it showed up, and now you have this disease, this terminal disease. I get that. That's beyond your control. But there's plenty of things that you absolutely have control over. And I would highly recommend that you start taking agency, right? We could do it together, just take agency, right? The more you take, and it's not information, it's not the information gap. It's just the agency gap, right? The activation energy that's needed for you to actually take the first step. So that was my rant about this article. I just wanted to share that. And I think it's only going to get worse, right? It's only going to get worse as healthcare costs start going up and a lot of these subsidies get written off. I think it's just going to get more expensive. All right. So my weekly update this week, man, I had so many things going on, I didn't work out as much. Like my steps are way off, as you can see, that's over 3,058, right? Down. VO2 max, I haven't even gone to the park yet. There's just a lot of things happening right now. I had to coordinate a lot of things with my dad, who's 77, and make sure that he gets the care that he needs. So that was just coordinating a lot of things and the time difference. So I wasn't able to actually get in my steps, my weekly steps. My sleep was off because of the time difference. I had to coordinate things in Kenya where my dad is, and so I was up like 3 a.m. So that threw a curveball to everything. It just threw a curveball. Like this week, I shouldn't even count it, but because of accountability to myself and to the people that actually follow this, and just to hold myself to a higher standard, I'll still report it, right? We don't throw out what we don't like. We include it so that we can actually learn from it, so that we can model and see, hey, because this is life, right? There's going to be times when you're not at your best. Like you're just dealing with a lot of things, right? Does that mean that you don't include that data set, or you throw it out, or you make excuses? No, but at the same time, we learn from it. Like, hey, what can I do next time something happens next time, I'm sure, because there'll be occurrences in life that are beyond your control, but you still have to give full attention to. Should that affect your routine? It shouldn't. You should still try and get whatever I did get a workout in. This was on Thursday. I was able to run, but as you can see, Saturday I did some yard work. I did a lot of work around the house, so those 5,000 steps are there for that. But other than that, you look at the week, like daily steps, almost nothing, right? But nevertheless, you learn from it and you get back on it's not how hard you hit, it's how fast you get up and get back to normal. So that was my weekly rant. And as you can see, a lot of red flags, no sleep records. My watch again's been acting up, It's not holding charge, and that's the reason why I'm actually going to get a Hume Health band, so that I can actually track. I think those can still track data for 14 days without having to recharge. So I'm actually going to get that band. I should be getting it sometime next week. That will really help with getting a lot of the data, and I think it collects even more data than the Apple Watch. So I look forward to that. HRV drifting down. So the good thing is my resting heart rate is going down, right? This is supposed to be going up, heart rate variation. But like I said, I was all over the place. VO2 max, I haven't even done. Last time was July 20th. So I definitely need to hit like a park or something like that. My sleep, they say it's getting better, but it's still sporadic. Like I said, I was up at 3 a.m., 2 a.m., trying to coordinate things. My weight, I'm sure it's up. It's more than 210 because, again, if I'm not there's a huge correlation between steps and weight. The more steps you put in, the lower your weight, And then blood pressure, I'm sure it's a little bit high. I haven't done any readings. But yeah, this is the status quo of everything. I'm still trying to keep my eating window, my fasting window. eating window is between noon and 7 p.m. Goal weight is 190 pounds. So that's my weekly report. Again, just wanted to touch on a trend that's happening. As you can look at this trend, employment-based coverage, and this is in the millions, other insured, Medicaid, ACA. So it's still something to pay attention to, because as we know, healthcare costs are definitely they're going to continue going up, and if you can hedge against that, then it's an investment. Think of it, it's an investment. Just like when you put money in a high yield savings account, you're doing the same thing. But now health is the thing you're tracking. All right, take care. Have a wonderful week. Lee signing out. Cheers.